Hi, welcome. This is another of Dr. Harris's herbal tutorials. I'm Richard Harris, and in this episode, I'll be continuing the discussions on conception. As you know, conception doesn't start and end with getting pregnant. There's the other part of carrying the baby full term. In episode 13A and 13B, I went into details about female infertility. In this video, I'll be discussing miscarriages. Miscarriages is defined as the abrupt loss of a pregnancy on or around the 20th week. It is estimated that roughly about 20% of known pregnancies end in miscarriages. But this estimate could be higher if the number of very early miscarriages, when the woman is not aware of her pregnancy, is taken into consideration. Modern Western medicine stipulates that miscarriages are as a result of a number of reasons, among which are infections, cancer, the use of alcohol, accidents, and even chromosomal abnormalities. Many of those reasons are what may be termed extreme cases. What about when none of the following exists, but at the drop of a hat, even with radical medical procedures like stitching and complete bed rest, there is still miscarriages? What are TCM views on this topic? Remember, common sense is the operative term here. But first, let's use the incubator as an illustration. The incubator was invented to provide a controlled environment that can be manipulated to provide a safe place where babies are placed while their organs develop. Without an incubator with its controlled environment, many babies that are born prematurely would not survive. If the temperature of the incubator is too hot, the baby dies. If it's too cold, the baby dies. If the baby is not being fed, the baby dies. If the incubator is missing vital parts and it's falling apart, it's problems for the baby. In episode 13A and 13B, I mentioned numerous reasons for infertility. Nevertheless, there are always exceptions to every rule. Many women experience those symptoms discussed got pregnant. The problem, though, is since they got pregnant under those conditions, there's always the possibility of miscarriages or problematic pregnancies. Now let's look at the common sense and practicality of TCM, traditional Chinese medicine. The womb is viewed in the same light as they would an incubator. So any one of the issues above that are affecting the incubator can be applied to the womb. So the temperature in the womb can be too high, too low, no nutrients, etc. In TCM, miscarriages are due to a number of reasons. Firstly, cold, dampness in the womb. This manifests symptoms of a tendency to feel cold, the lower abdomen feeling cold, as if the abdomen is being fanned, constant urination that is clear, lower abdominal pain. This in TCM indicates the opening of the uterus, and the baby will abort itself from the cold environment. The principle of treatment is to warm the uterus and calm the fetus. A second reason is heat affecting the womb. This condition manifests symptoms as thirst, excessive fetal movement, that is, the fetus is restless because of the heat, always feeling hot, and disliking of heat, reddish vaginal discharge, fever, constipation, heat in the hands and foot, night sweats. This condition also makes the baby abort itself. Principles of treatment: eliminate the heat and tonify the blood and yin. In the above two syndromes, the baby is aborting itself. It is removing itself from an unfavorable environment. It's akin to the extreme cold or hot temperature in the incubator we touched on earlier. You and I would respond the same way if we were in a room and the temperature was extreme one way or the other. A third syndrome is kidney deficiency syndrome. This type of patient has a tendency to abort. In this situation, the body is weak, primarily the kidneys, and is unable to deal with the stress of pregnancy. Treatment tonify the kidneys. Another syndrome is deficiency of qi and blood. This has symptoms of bleeding during pregnancy, reddish discharge, lower back pain, pale complexion, exhaustion, shortness of breath, and palpitation. This syndrome is related to the baby not getting nourishment. This condition is treated by tonifying the blood and qi and to strengthen the spleen. Identifying the causes of miscarriages in relation to CCM is relatively easy. The disappointing part is the herbs used to treat the above conditions are not readily available in the Caribbean. While I have been able to identify a great many Chinese herbs growing in the Caribbean, many of the more important ones, like the ones classified as qi, blood, yin, and yang tonics, are not readily found, or there's nobody in the Caribbean to process them to get them to do what the Chinese would use them for. But don't despair. We have a large contingent or influx of Chinese in the Caribbean these days. And Chinese people walk with a culture. So in many of the groceries, you can start to see many of the Chinese herbs that are used for these conditions of miscarriages and inability to conceive and so forth, besides the ones that grow here that I've identified and I will bring to you at the proper time. That's all for now. Follow me on YouTube for more herbal insight. Remember to like, comment, share, and subscribe. Remember, your subscription grows the channel. The channel grows and I post more videos. You will therefore learn more about the herbs growing in your backyard. Bye.